Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and we're back looking at something brand new today.
This is a really exciting departure from our normal hematology stuff. And so where Melissa and I kind of grew up as techs, we did body fluid differentials and body fluid cell counts and things like that. So and there's not a lot of resources for this, right? Like
Yeah.
so
Well,
we figured we'd kind of dive in and explore this. So
and people have been asking for body fluids, so
there you go, right?
here we are.
So if there's a need for it, why not?
Yep.
You know.
All right. So first, let's say we're starting off with a synovial fluid.
Yep, yep. So synovial fluids can come from a lot of different areas. I think most of the fluids that we analyze are usually like knee fluids, the most common joint that we'd want to look at. And I'd say like joint fluids kind of have like typical sort of the normal look, and this kind of like jives with what I might expect to see on 10x, right, on low
Yeah.
power for a synovial.
Well, I think too the other thing with synovials is you're generally not going to see malignant cells.
Right. Yep. Yep. So yeah, I think they're easier in a sense. You're not as on guard. Pleural effusions and pleural fluids, things like that, are, you know, usually much more consequential. Someone with arthritis, or um,
I mean, this could be right. It could be an infection. It could be a crystals
mhm,
still, but you're not looking for malignancy. So it's
right.
just slightly different.
Yeah, the stakes are lower, sort of, kind of. I guess I don't know. Um, but yeah, so 10x. What do we see here? Looks like a lot of cells.
Lots of cells, lots and
Mhm.
lots. So we'll just scan around on 10x.
Sure. Yeah. Um, So being a different preparation, there's no like thick or thin area necessarily, or the certainly some fluids will be pretty thick,
Yes.
high cellularity. Um, so 10x is a great opportunity to kind of scan and see if you're seeing like big clumps of cells, or if anything in particular sticks out to you.
Yeah, look to see if there's any like big scary cells.
Yep, definitely.
Also
So
looking for the distribution. So
yes,
this
yes.
one looks fairly evenly distributed.
Hmm.
But
Hmm.
if you're looking at one portion of the cytoprep and you see that over here there's a larger concentration of mononuclear cells, and then over here there's a larger concentration of what look like neutrophils, then you might do a mixed count,
Hmm.
or you might do a count over here and a count over there and average them. So
Hmm.
getting that distribution to see a good area for a count.
Yes. Yeah, it's a great point that cytospins can be they don't have the same quality of random distribution that push prep peripheral blood smears might have. So
Yeah.
being selective about where you go. It happen all the time where I might do a differential, count 100 cells, someone else might count 100 cells, and just because we focused in different areas, we get a high degree of variability.
Yeah.
Um, so
I think that's the other thing is even with peripheral blood smears, you can generally get a a relatively okay correlation between techs doing counts, but when you're thinking about body fluids, it's a wider variability of what you're going to find for the diff result.
agreed. Sometimes it's a skill thing, and sometimes it is just
An area.
yeah, the messy
Yeah.
area, the areas can be tricky.
All right.
Um,
Want to pop down to 40?
let's do that. Let's do that. Beautiful. So yeah, we see a lot of cells here, and it looks like a pretty good mix. So one of the biggest challenges is the number of cells is like a lot, right? So
Yeah.
um, I think it's a skill in and of itself. It's a skill that kind of overlaps with retics. I think about like counting a retic count is similar to doing a concentrated body fluid like this, because you really have to be careful to keep track of, as you're counting cells, that you don't count them again, or that you're not just skipping over cells.
Yeah.
So Sometimes I will focus on the clusters as like an object and kind of move through
Hmm.
the object somewhat systematically, because it's not hard to double count or undercount,
Yeah.
depending on what's going on.
Yeah, and I think people will find that they'll develop their own
Absolutely.
method. Like maybe you'll go clockwise or counterclockwise as you move across or a really cellular field or whatever method. Everybody develops their own, and there's no wrong way to do it as long as you're counting all the cells in the field and you're not double counting them or missing them.
Yep, 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 yep. And yeah, you said it perfect. I wouldn't add anything. Yep.
Do you want me to just jump down to 100? Or you want me to look around?
Yeah, yeah. And the other advantage too to going to higher and higher magnifications, while I might be inclined in a lot of peripheral bloods to use like a 50x, 100x can be very valuable because it just narrows your field, right? I don't have as many cells kind of overwhelming my vision. How beautiful. Awesome.
Very cool. So, first thing that I want to point out is that these are not eosinophils.
Yes, they're not. Yes. So you might see as the viewer, the color is not quite neutrophil color. And part of that is it's the how everything looks, the stain's going to behave based on the pH of the fluid.
Yeah.
And when it comes to blood, the pH range of blood is very, very tightly homeostatically controlled. So we get very consistent coloration and staining. What you'll see in body fluids is that they could be bluer, they can be more devoid of color, like maybe lighter. Like CSFs tend to not have as much color pop to them.
Yeah.
So truthfully, an eosinophil, you really should look for the granules themselves, right, Melissa?
Yeah.
Because color is gonna fail you sometimes.
And I think we emphasize that when we talk about peripheral blood smears, but I don't think, especially in the beginning, people are kind of like, meh, meh, meh. And then they'll just really look for the color, but
Yeah.
you really do need to look for the size of the granule because EO granules are large and chunky of
Mhm.
equal shape and equal size, but they're large and chunky, whereas neutrophilic granules are pinpoint. And so we can see that these granules, I mean, especially over like right here, where it
Mhm.
looks like a nice bright pink color, but the granules are pinpoint. I can't even really see them very well. So they're so small that it's neutrophilic granules. It's just the pH of
Yep.
the fluid impacting the color uptake of the granules.
Yep. Yep. And the other thing that we cheat with too, I think, as the morphologists, is like EO counts are usually really low in peripheral blood. So like even if you mistakenly count one extra one or not enough, but you can have some body fluids that have a ton of EOs just based on the underlying pathology. So
Yeah,
just look for the
absolutely.
granules.
Well,
Make
and
it
then
prove to you it's an EO.
yeah, exactly. And then it depends too, because especially if you're doing like a urine eosinophil count, that
Mhm.
can be really important for like thinking about kidney rejection and transplant patients. So
Mhm.
then it's more of a high stakes test where you don't usually think about eosinophil counts as high stakes, but it can be. And we know that the pH of urine can vary widely. So it's just important with bodily fluids like synovials, like urines, that if we're counting it, we're really evaluating not just color,
Mhm.
but
Yep.
also the actual characteristics like size of granules.
Yep. 100%. So I'm glad you brought that up. So I'm grabbing my annotation tools here. So we have a couple of morphologies that kind of stand out to me. We have a lot of like neutrophils, right? Just kind of they're making themselves easy in that they have that those lobes, those segments, beautiful, right? Beautiful neutrophils. And then we have I'm trying to think what's the best one to they're kind of on the periphery here, but let's see, is my arrow gonna work? It kind of went off screen a little bit. But up in the corner there of our screen, we have what looks like at our institution, we label a monomac. So monocytes and or macrophage. Um, so should we talk about that?
Well, monomacs.
Yeah, I don't know if that's like a subject in and of itself.
Yeah, so some institutions separate monos and macs, and some will lump them together as a monomac.
Yeah,
It can be challenging. Like these are straightforward. If you had to separate, these are monos, right?
yeah,
Nice,
yeah,
easy put together. They look like peripheral blood smear monos,
yep.
whereas macrophages are usually bigger, fluffier.
Hmm.
The nucleus is rounder, not pleomorphic,
Yep,
but it can be challenging to differentiate between monos and macs.
it
And
can.
so for our purposes, Dave and I are just going to call them monomacs
Yeah.
because that's how we were trained.
It's how we were trained, and in my heart of hearts, I think that's the highest balance of utility. And because at some point in the community, some of us may have that skill to differentiate, and then some of us may not. And how much utility are you gaining from having a bucket for macrophages and a bucket for monos? I mean,
Yeah.
I personally don't buy it. So yeah, we'll lump those together. We're going to be easy mode, I guess. But yeah, so I see neutrophils, I see some monomacs, and it's likely we'll probably come across a lymphocyte or something as we go, but I don't
Yeah.
necessarily see it in the field.
So here, all of the orangey looking ones, those are all neutrophils.
All neutrophils. Yep.
Then you get to things like, so like this is squished. I can't tell what it is,
Yep.
so I'm not going to bother with it.
Yes. So this is an important factor. I usually hate schistocytes.
Yeah.
I am the anti-schistocyte guy, right? It is very important with body fluids. These cells are in a place they're not supposed to be, right? The cell turnover ratio is very, very high. These cells are going to die, degenerate. And so you'll get like nuclei or nuclear material that's just kind of bleh, like blobs, and you'll see all sorts of stuff like that. If you can't positively identify the features of the cell, don't call it. Okay.
Yeah.
Um,
And by that, we don't mean like it's a like a blast or like a challenging cell to identify. We mean if you can't physically make out what it is.
yep.
Don't skip it because it's hard. Skip it because it's physically not possible to figure out what it is.
Excellent clarification there. Yes. Because I hate when we skip things because it's hard.
Yeah.
We should embrace the challenge and
Yeah.
seek more experienced individuals. So then there's one other thing that I think is relevant for body fluids, synovial fluids, perhaps, that I see in this field here. Yeah, she knows. She's a pro. So I see this really cool feature in this cell here. So I'm going to draw. Won't let me get my drawing tool. There we go.
Got it?
So we can see up in the corner this over here. There's a terrible other arrow. Oh, and there we go. I'm going to clear that away so it's out of the way. It would appear to me that a monocyte macrophage, whatever we would like to call it, has eaten probably a dead or dying neutrophil or some other kind of debris. So this brings us back to the physiological functions of the cell. Macrophages, monocytes are kind of the garbage men, very important function of removing materials, and it's part of healing, right? So as cells die off, tissue cells, whatever it may be, macrophages are going to eat that stuff and digest it down. So, it looks like it was probably a white cell to me. And we have a really cool word for that. Leucophagocytosis is what we might say is a qualitative comment. And to me, what that expresses to the clinician is that these cells didn't just get there yesterday.
Yeah.
Right? This fluid accumulation, this effusion, whatever it might be, this has been going on for a little while.
Yeah. Yeah. So there's leucophagocytosis, which is here.
Yep.
And then if we had erythrophagocytosis, that would be ingestion of red cells. And that's
Absolutely.
typically after there's a bleed into
Mhm.
one of the whatever fluid cavity it's found in.
Yep.
And then when monos are just kind of ingesting junk and cleaning up, it's called necrophagocytosis.
Yep.
We're just kind of cleaning up the necrotizing junk.
So all cool comments in our toolbox for us to express to the clinician qualities about the fluid.
Yeah.
And then with joint fluids, I'm not a microbiologist, but I do my very best, and we're trying to look for possible bacterial organisms or anything. At the moment, I don't see anything,
No.
but we'll be careful and look for that as we go.
Well, and we're looking for that or crystals when there's
Yeah.
this many neutrophils.
Yeah. My hope was that there's crystals and we might happen upon it, and it might happen organically. So yeah, common in joint pathology is for, we've all heard of someone having something called gout. So we can have a buildup of chemicals that then are supersaturated, so they precipitate and form crystals. Crystals inside joints hurts. It
Hmm.
hurts really bad. So we would want to tell the clinician if we see crystals, they would know, okay, this is a gout problem, or is this an infection problem, right? So infection is a medical emergency that may need surgical debridement, and it could endanger someone's life. The crystals are less, I think, I'm not a doc, but less pressing thing to, but we want to be able to give them that information and narrow down the differential diagnosis.
Yep. All right, let's move around a little bit.
Let us do that. My wonderful driver, Melissa. Beautiful.
Yeah.
Okay, so we got some lymphocytes have joined the party.
Yep.
So I have one beautiful lymphocyte here. I'll horribly draw. And, so with lymphocytes, round nucleus, scant cytoplasm, we expect that to kind of be consistent. Because it's a cytospin, the lymphs might appear a little bit larger than you might expect. That's okay. So the nuclear cytoplasm ratio will be really important here.
The other thing is the nucleoli will be more prominent in
Definitely.
lymphocytes.
So this is one of the big struggles for someone who learns peripheral blood and then moves into body fluids. Stuff looks scarier, right? Those little features that would look somewhat normal on a peripheral blood are going to look intimidating in this format.
Yeah.
So,
Well, and I think we have the lymph there, and then the
yep,
lymph here, and a lymph here.
yep, yep, yep. We got another one up here too, I would argue. And then maybe for this is another one. So this is where things get a little bit trickier too. We got this cell over here.
Yeah.
So
Let me pull it. Well, let me pull it in so
sure.
we can. Hold it there.
Perfect. So there's, oh, let me start. So my intuition is this is probably a macrophage. And I can tell that based on the shape of the nucleus. It's oval roundish, right? So our monocytes usually have the really kind of twisty, bendy.
Here.
And then this exactly right next to it, perfect. And then the cell size is generally large-ish, right? It's maybe a little bigger than our monocyte pictured there. What I want to discern this against, what I want to be careful is this a synovial lining cell, or is it a monomacrophage? And I'll be honest with you, it's not easy. The big clue for me, typically, Melissa, is the color. Synovial lining cells tend to have a deeper, richer kind of blue to them than.
The other thing that I like to look for that not all lining cells will have will be kind of the edges. You kind of look for it's not quite frayed, but it's not quite as smooth as the macrophages. And think about lining cells. Lining cells are lining the synovium, and so they're kind of connected. They're holding each other to maintain the lining. So when you're sloughing off those lining cells, you can kind of see where they were connecting.
Yep, absolutely. Yeah, so those cells are tissue cells, and I know exactly what you're talking about. They'll have like little maybe bubbles, or there might be like a fraying,
Yeah.
as you described. Yeah. And then this looks like a discrete cell, right? Nice and neat and clean on the edges. So probably an easy mono call.
Yeah. Yeah. The other thing too that's a little challenging is see all this like random stain.
Mm-hmm.
There was some earlier that I was playing with the fine adjustment because I was like, wait, what? Oh, it's because like right here, this is where I was looking. I was like, are those diplococci? Like the two
Mhm.
little cocci together? But I don't think they are. I think it's just stain.
Yeah,
And occasionally you'll see little cocci on their own, but
yeah,
really you
yeah,
typically see them with friends,
yeah,
pairs, chains, whatever. But intracellular bacteria is like bread and butter
yeah.
for a synovial. So
So that is the gold standard. We'll all, even ones that have done, we've done this for years, we'll always struggle. Oh, is that an organism? Is that not? Intracellular, you'll see they have a prettiness, an evenness to them. They're exactly like the shapes that you expect them. So don't twist yourself into a pretzel as to
yeah,
whether a piece of junk that's got like edges or something is bacteria. Um, I like to kind of say, stay in your lane. If you know it's bacteria, call it.
yep,
It's an important conversation too, usually. But oftentimes these body fluids are going to the microbiology department as
yeah,
well, that are going to do a gram stain, and they're going to grow a bug, right? They're
yep,
going to they're going to grow them if they're there. So
yeah,
try not to raise alarm.
yeah,
And yeah, and I also loved, in our place of work, I could go to micro and I could say, hey, do you got a minute,
yeah,
so I always encourage interdisciplinary kind of conversations and stuff.
yeah.
So
Yeah. So I think then like all of these again, these pinky cells, those are all neutrophils. A
great.
couple of macro monomacs, mono mat, right? Mac kind of thing, and then a couple of lymphs,
Couple limbs. Yep.
macro. This one again, he's kind of squished. He looks lymphy to me.
Yep.
I
Same.
wonder if he's more of a reactive lymphocyte than a regular lymphocyte.
Yep. That's my intuition as well.
Yeah,
So yeah, maybe I call one reactive
yeah.
lymph there. But,
Okay.
and this is the tricky part about body fluids. This field has got a decent amount of lymphs. The very first field we looked at had none.
Yep.
So yeah, expect your differential to vary slightly.
That's why
We
area is so important.
It is. It's very important. Sometimes volume's important too. We worked with people that would routinely count 200 cells. I wouldn't necessarily advocate for that, but I could see why someone might feel
I do it
compelled.
sometimes.
Yeah, sometimes I think it's a worthy thing. Um,
Sometimes. Not always, but I do. I've done it enough times.
yeah, yeah,
Again, I think we just have a bunch of neutrophils.
good.
It's mono lymph, and that's a nice looking. If you look at it, one might think, "What is it? A plasma cell?" Because it's so round and eccentrically placed. But again, the placement's going to be off because we're dealing with the cytoprep.
Yeah, yep. Yeah, so I'm less sensitive to the
Yeah.
eccentricity, and the color should be much deeper and richer, and some variability there. I don't see that. So yeah, I agree with you. Yeah, this is an
Yeah, and like
awesome slide.
just look at how
Yeah.
pinky orange.
These poor students, right?
Oh yeah, this one's challenging.
Oh
But
man.
again, size of the granules.
Yeah. Yeah. You can't see the granules, so therefore, right? Like you just assume it's a neutrophil. Yep.
Yep. Yeah. I'm
Yeah,
trying
not
to
too
see if
much
there's
else.
any like interesting
Sure. Yeah, we want those
findings.
cool intracellular findings, right?
I don't know if there's any on this one. This one's pretty
The
standard.
the other thing I might expect too is we might want to look for like necrotic or pycnotic cells.
I was actually just thinking about
Oh, cool. I think, yep, we got a couple right here. Maybe not the most perfect one, right? Um,
that. Yeah.
so what we'll notice about certain nuclei is that there's no chromatin pattern at all, right? It almost looks like the DNA has liquefied, for lack of a better term, and you get this very dark very even, smooth feeling in my mind, the texture nuclei. That's just a necrotizing or a dying neutrophil.
Yep.
And when we look at the neutrophil lifespan in a joint space like this, especially during a pathology, they die very fast.
Yeah.
They're totally not uncommon. And another thing that maybe your institution that you work for might want you to comment on, and this also speaks to the age of the effusion itself, how long it's been there.
Mm-hmm.
That's cool to see. Get my screen.
So let me just go out to the edge too.
Sure, yeah. Yeah, we can see that as you get to the outside of the ring, we get a different presentation. We could see the cells look a little bit more, a little larger. Get a little space to spread out, sort of.
Yeah, they get spready. They may even smudge.
Yep.
Guys
Yep.
are smudgy.
Yep. Yeah, and this might be a good area where you can actually find a crystal or find bacteria or something like that.
Yeah.
Also a reminder, if you prepare a cytoprep and it's so thick, it's so dark, you can't see anything, do a dilution on the side and make the slide off of the dilution. These are words of wisdom from me.
Just write the dilution on the slide.
Yes, 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 yes. Excellent habit to get into. Because it may not be you reading that slide.
Yeah, and you want to correlate the cellularity to the cell count.
As best you can. Yep.
So if you don't, if you didn't make it and you don't write the dilution on the slide, the person's gonna be like, "Why is this white cell count so high?"
Yeah, exactly. Yep. Cause confusion.
Well, I don't see anything too exciting. I was looking to see if there was any like lining cells or there's a big ugly cell there underneath.
So unfortunately, it's a shame because that looks like it might be a good lining cell. I think we can still, so there's something shadowing it. So it's tough for us to look at the nucleus. But remember when Melissa talked about that rough edges? This is exactly the type of feature. So I'm trying not to point at the neutrophil so much, the blue cell, but those little blebs and some of that roughness.
Yep.
Man, that speaks to it being likely a lining cell, a tissue cell. And then the color that I kind of talked about, it's got a deeper, richer kind of a blue coloration to the cytoplasm, because we can see there's some monos in the field here, right? Much more gray, kind of lighter color on the cytoplasm. So yeah, I believe that that's probably one of the few synovial sites on the smear.
On this one, we'll have other smears that'll have more. Hopefully, they won't be covered
Totally.
by mysterious dark objects.
Yeah, totally. Yeah. I mean, some might be a ton. There might be a lot of lining cells in a given smear.
Oh.
Yeah. Yeah. And so I got to be honest, these are the cells that like, geez, I'm trying to draw a straight line. Those are the types of cells for me that are total judgment calls.
Yeah.
And you know, differing minds, right? Might kind of feel differently. I think given the darker color of it, I'm like inclined to like lean towards a synovial site, but tough. I don't know. What are your intuitions?
I'm comparing them to the things that I know are monos.
Yep.
So like I know this is a mono.
Yep.
Then I'm looking at the chromatin patterns. So this chromatin pattern to me doesn't really match this chromatin pattern.
Yeah. Yeah.
I think it matches more closely this one, although this one doesn't match that one either. I think these are more of our monos.
So it's almost like on a technique side, we know that this is different. Oh, I'm terrible at this. We know that this is different than these.
Yeah.
Right? And then it's like, well, what's the best title or, designation for those. Well, these look more like monos. And so then this must be a
A
lining
lining
cell.
cell. Yeah.
So that would be like the thought process there. I would not like get into an argument in the lab about what this is personally.
No. I'm
But
debating
that's my
about this
intuition.
one. It's got the similar coloration to these guys, but
Yeah, so that one is a jerk, and it's somewhere between the morphologies, isn't it? Yeah.
yeah. Based off of the cytoplasm, I'd probably go with mono.
Yep. Yep.
But yeah, he's not a nice cell. I don't like him.
Yeah. Tough calls. Tough
Yeah.
calls. This is not a perfect science. And then also think about clinical utility here.
Right.
We could all just spend hours agonizing over a single cell. An extra lining cell or one less lining cell in the differentials, not going to influence the clinician's.
Right. Because again, we said we're not looking for malignancy typically.
Right.
So malignancy is what you worry about in like plurals and things like that. And if there's a lot of mesos or the lining cells there, you're thinking, well, maybe it's mesothelioma or something wrong with those mesos. So that would be something completely different for us to agonize over.
Yes. And maybe we say, hey, pathologist,
Yes.
right?
Yeah.
But I'm not going to waste a pathologist's time with this. I'm not going to waste another tech's time, to be honest with that.
Yeah. Yeah. Agreed. All right.
Cool.
Well, I don't think there was a whole heck of a lot too exciting with this synovial, but I think that's okay for the first synovial that we look at.
I think so too. Cool. All right.
All right. Well, everybody, thanks for watching.
Yeah. Thanks you for your time.